Hi everyone, welcome to Nursing Guru. Myself Nayana. Today I am dealing with the topic acid-base imbalance. As you all know, acid-base imbalance is an important topic in nursing field. So let me discuss about the definition of acid-base imbalance and what all are the types of acid-base imbalance and how easily we can tackle or we can understand respiratory acidosis, metabolic acidosis, respiratory alkalosis and metabolic alkalosis. Let's start. Before learning acid-base imbalance, first of all we should know what is an acid-base balance. Usually we will say that a hydrogen ion is a proton that is released by the hydrogen atom, and an acid is a molecule that contains hydrogen atom and that atom releases hydrogen ion. Whereas base is something that accepts hydrogen ion. So we know we are going to learn about what is acidosis and what is alkalosis. So acidosis refers to excess addition of H plus or hydrogen ions into the body fluids or into the bloodstream, and similarly alkalosis refers to excess removal of H plus ion from the bloodstream or the body fluids. So first of all, we should know what is this acid-base imbalance or who maintains this acid-base imbalance. Mainly, this acid-base balance and this imbalance is maintained by the buffer system. The two organs are involved in the buffer system. First one is the kidney and the second one, the respiratory organ, that is the lungs. So the lungs and the kidney both act as the buffer system or the buffer organ in maintaining acid-base balance or maintaining acid-base imbalance. Let's look how this both organs functions or maintains this process. First of all, as you know, kidney is always associated with metabolic related activities. So in the kidney, there is mainly HCO2 plus H plus ion. So when this HCO2 and H plus ion combines, we will get H2CO3. We will get H2CO3. Similarly, in the lung or the respiratory organ, there is carbon dioxide and water, that is H2O molecule. So when this H2O combines with this carbon dioxide, we will get H2CO3, that is a similar thing like kidney. So both these organs function together or work in coordinated way in order to maintain this acid-base balance in our body. So before learning in detail, we should know what is the normal value of acid-base imbalance or how we can tackle this easily. First of all, we should know the normal pH of the blood. The normal pH level is between 7.35 to 7.45. And also we should know the level of partial carbon dioxide which is present in the blood. Normal level of carbon dioxide is about 35 to 45, and similarly oxygen is about 80 to 100. Then we should know the level of bicarbonate. Bicarbonate level is normally ranging from 22 to 27. So after learning this normal values in detail, we can easily tackle the problem associated with finding respiratory acidosis or metabolic acidosis. So as we know, the acid-base imbalance include mainly respiratory acidosis, respiratory alkalosis, metabolic acidosis and metabolic alkalosis. There are four things, that is respiratory acidosis, respiratory alkalosis, metabolic acidosis and metabolic alkalosis. So as I told earlier, if the carbon dioxide is present, it is related to something related to lungs or the respiratory system. Similarly, if it is associated with kidney, then we should assess the bicarbonate level. So carbon dioxide is related to respiratory and HCO3 or bicarbonate is related to metabolic, that is related to kidney. So as we know, the pH level for acidic condition or acidosis is less than 7. So if the pH is in between 7.35 and 7.45, it is said to be normal. If the pH comes or falls below 7.35 or below 7, then it is known as acidosis, or it is the acidic condition. And if the pH is above 7.45, then it is the basic or it is the alkalosis. So pH, if it is below 7.35, it is acidosis, and pH, if it is above 7.45, it is known as alkalosis. So the first and foremost thing that we should observe is whether it is coming under acidosis or it is coming under alkalosis. That is the first thing. Then we should check whether it is respiratory or metabolic. For that, we should check the value of the carbon dioxide. If the carbon dioxide is decreasing, and on the same side, if the pH level is increasing, that is carbon dioxide level decreases and pH level gets increased, then we can see that will be respiratory acidosis, because the pH is below 7.35 and here the carbon dioxide level that is getting increased 35 to 45. If it is greater than 45, then we can say the patient is having respiratory acidosis. Similarly, if the pH is getting decreased, pH is getting increased and the carbon dioxide level is decreasing, pH increases and carbon dioxide is decreasing, then that is known as respiratory alkalosis. So earlier we learned or we discussed about respiratory acidosis and respiratory alkalosis. Now we can learn what is metabolic acidosis and metabolic alkalosis. In metabolic, as I told earlier, that is HCO3 level where we have to focus. HCO3 level that is associated with the kidney that we have to focus on. So, if the HCO3 level is getting raised or it is increasing, and on the same hand, if the pH level is also increasing, that is HCO3 level and the pH level comes together, both increases together or both goes in the same way, then if the pH is increasing and HCO3 level is also increasing, then that patient is having metabolic alkalosis. As the pH is increased, it is having metabolic alkalosis. Similarly, if the pH declines or if the pH is decreasing and the HCO3 level is also decreasing, both pH decreases and HCO3 is also decreasing, then that patient is having metabolic acidosis. Metabolic acidosis. So, in carbon dioxide level, if the carbon dioxide increases, proportionally pH decreases, then the patient is having respiratory acidosis. And if the carbon dioxide is decreasing and pH is increasing, patient is having respiratory alkalosis. Similarly, coming to metabolic acidosis and metabolic alkalosis, if the HCO3 level increases proportional to pH level and pH increases as well as HCO3 level increases, then that patient is having metabolic alkalosis, and pH increases and also HCO3 level decreases, then the patient is having metabolic acidosis. That is regarding respiratory acidosis, respiratory alkalosis, metabolic acidosis and metabolic alkalosis. This respiratory acidosis, alkalosis, metabolic acidosis and alkalosis is of three types, that is partially compensated, uncompensated and compensated. That is partially compensated, uncompensated and compensated respiratory acidosis or respiratory alkalosis. So, in case of compensated respiratory acidosis or alkalosis, the pH remains normal. If the pH value is normal and the other two are changing or pH is normal, in that case we can say that the patient is having compensated respiratory acidosis or alkalosis. Similarly, if the pH, HCO3 as well as the carbon dioxide level, both three of those levels are changing, then it is known as partially compensated. And the last one, that is the uncompensated. In that, the HCO3 and the CO2 level will be varying. HCO3 as well as CO2 level, both of this or any one of this will be varying, and that patient will be having uncompensated. So the patient will be having either compensated respiratory acidosis or alkalosis, compensated, uncompensated and partially compensated. These are the three types of respiratory acidosis or alkalosis. Next, let's discuss which all conditions or some of the conditions that is associated or that leads to this acid-base imbalance. The first one, that is respiratory acidosis. As you all know, in respiratory acidosis, pH is decreasing and carbon dioxide level is increasing. As carbon dioxide level increases, what will be the level of oxygen in the blood? The oxygen level will be decreasing. So, usually respiratory acidosis is associated with the patients who are having problem with the oxygenation, that is low oxygen level, in case of pneumonia or chronic obstructive pulmonary diseases, respiratory distress. In those cases, oxygen is decreased in the blood. So, in that cases, the patient will be having respiratory acidosis. Similarly, coming to respiratory alkalosis, here also the patient pH will be increased, pH level will be increased and the carbon dioxide level will be decreased. As carbon dioxide is decreasing, the oxygen level will be increased. So, this respiratory alkalosis could be seen in case of patients who are having hyperoxygenation or hyperventilated, mechanical ventilation and all. If the patient is having or getting hyperventilated or hyperoxygenated, in that cases the patient will be having respiratory alkalosis. The same way, coming to metabolic acidosis also, the patient will be having HCO3 level decreased, bicarbonate level will be decreased and the pH level is also decreasing. So, he or she is having metabolic acidosis. In that case, the patient will be having potassium and calcium at a low level. They will be having potassium, calcium, that is hypocalcemia and hypokalemia instead of hyperkalemia or hypercalcemia, because the bicarbonate level is decreasing and the pH level is also decreasing, and he or she is having metabolic acidosis. Usually it is associated with conditions like diabetic ketoacidosis, lactic acidosis and shock syndrome. In these cases, we can see that patient is having or usually they will be having metabolic acidosis. Coming to metabolic alkalosis, it will be associated with some of the GI disturbances like diarrhea, excessive vomiting, gastric irritations. So, excessive vomiting, diarrhea that are associated with the GI problems. Hence, that patient will be having increased HCO3 level and increased pH. So, the patient will be having metabolic alkalosis. This is the condition, some of the condition or examples of the conditions that is related or associated with this acid-base imbalance. Hope you all understood this acid-base imbalance and related topics. So, let me wind up this class. If you have any doubts, please comment it below. And more videos related to this topic and many other topics are coming soon. If you are the first viewer, please subscribe. Thank you for watching and bye.